Good evening and welcome to the Presenter Series. We've got a really exciting lineup tonight. I'm Karen Hand, by the way. Michael Watson is here, and you're going to hear from Dr. Will Horton, and you're going to hear from Patti and Eric. Oh my God, of course I don't have it in front of me. Patti Scott. Why, how could I forget that? And Eric Rosen, of course, the names, the harder I tried, the further away they got until I relaxed and was able to say, we're going to talk about medical hypnosis coming up in a moment. But first, we're going to start with Will Horton, who, Will, I'm afraid that you're going to lose that whole thing about being the cowboy hypno guy because you're not wearing your hat tonight. You're going to get the addictions hypno reference from now on because you're wearing this recovery stuff. Will Horton, by the way, in case you don't know, is considered by some to be one of the world's leading expert in using NLP and hypnosis in the treatment of addictions and performing arts and lots of other stuff. He's worked with tens of thousands of people. And what he's going to do at the IACT IMDHA conference is a pre-conference, very special. And Will, I'm so impressed by this. You're doing a full one-day pre-conference that's absolutely free. All you have to do is come in early and you attend his one-day workshop, and it's free, and you spend the night and then you do the conference. It's pretty incredible. The workshop is Rapid Addiction Solution Masterclass. Well, I can't wait to hear all about it. I got to ask you first, free. I really appreciate it. I think that's such a great way to do it. Thank you so much. But why did you decide to just give all of this important knowledge away?
Well, funny you should ask, right? Funny you should ask. I was talking to Bob, who I've known for 40 years, give or take, well, quite a while. And, he asked me, to come to the conference. I said, well, I'd really like to do like a full day on addiction, but, make it free because it's a subject that's near and dear to my heart. And one of the reasons I wanted to do it is because a good example would be just this last weekend, we spent all weekend at the rodeo. Me and my wife were at the rodeo here. It's the fourth largest rodeo in the country. It's right here in the middle of Florida called Arcadia. And she goes every day. I go 2 days with her, right? And that is, and I before I put on my recovery shirt, I had my Horton Ranch shirt on, So I was telling Bob, I want to do this because I don't know how much longer I'm going to keep doing this, and it's like, I love what I do, but I also like doing other things, hanging around with the horses. Some of my other career came back where I do film and I'm acting and doing that. And because I've been given these gifts, and a lot of it is through hypnosis and the NLP, that, I decided to not to use the used term give back. But the other reason too is I think hypnosis is one of the missing ingredients in people recovering from either substance abuse disorder or substance abuse dependence. And tonight I'll talk a little about what's the difference between those two. But I think this is one of the missing ingredients. So that's why I'm doing the freebie.
You do have a little bit of personal experience in this arena also, do you not?
Yes, yes. An addiction. Alcohol was my drug of choice. Took away a lot of things, right? When I first got out of high school, I wanted to be a pilot, and I'd had a scholarship set up. I screwed that up because of my drinking, but I still got in the Army to go become a helicopter pilot, and was doing quite well, except again, the addiction kind of got in the way, so I finished out the Army thing. Because halfway through, I started thinking, it's not that I'm an alcoholic or I have an alcohol or drug problem or anything like that. It's the fact that, I have an Army problem, right? I have an Army problem. And so I said, what I really am in my heart is an artist. I want to be an actor, right? Which I think is kind of funny because I'd never seen a play in my life. And I decided I want to be a theatrical actor. And so, because sometimes God takes care of drunks and fools, I ended up in the American Academy of Dramatic Arts, right? I was an affirmative action baby, not to use politically incorrect terms now, but I was considered a Vietnam era vet, and they had a slot that they needed to fill, so they let me in. So I started to follow a passion, and I really loved it. I got into it, and again was doing quite well. But after a little while, the addiction took off and ruined my acting career, right? And so, and then I went through a series of, the Veterans Administration, treatment centers, a couple other things. And one day I was at someplace, and this lady did, as I didn't know what it was at the time, but it was like a guided meditation with some, what I would know now as some NLP techniques buried in. And suddenly everything made sense. The 12-step program, how the therapy was supposed to work, the fellowship, all of this stuff, it just like coalesced into, oh, that's what this is about. And then it was easy, and not easy, but from that moment on, my life started to change. And I ended up studying, actually, I studied NLP before I went back and studied hypnosis. Even though the first time I hypnotized somebody in high school, I had a book, some of you might remember it, called Hypnosis for Change. Maybe Dr. Rosen remembers it. It was like an orange book and it had a script, and you just read it. And I did that with some of my friends, hypnotized them, scared the shit out of me, you know. I didn't follow up. I did make some self-hypnosis recordings, but back then they were little reel-to-reel tapes. That's not to date myself. There wasn't even cassettes then, right? For sports and some other things. So anyway, but I put on the back burner. But when I first got really serious about this in the early 80s, it was easier to find an NLP training than a hypnosis training, right? Because there was no internet. The only guy I know doing hypnosis training back then was, HMI or Gil Boyne. I didn't even hear of him. So I started studying hypnosis, then I stumbled across hypnosis training, and, here I am. And I did go back to school, get my doctorate in clinical psychology. So I still do that.
So you have a lot to bring to the table and a lot to teach. Let me ask a question right now that I'm sure you're going to expound on in your workshop. But so you talked about, you shared with us that you had an addiction. You also called it a problem. A lot of people say, "Oh, I got a problem." How do you know the difference between a problem and an addiction?
Well, it's kind of like the difference between a substance abuse disorder and a substance abuse dependence, right? Now we know, a few people on the call know that, like, in the last 20 years, everything we know about addiction has changed. It's absolutely changed. And, if you'd have talked to me 25 years ago, I had a certain mindset, hardcore 12-step, this is the only way. And then we started learning all this stuff about the neurology of what's going on in your brain when certain things happen. It's a brain-based issue that people, and so, it made me probably 20, 25 years ago, step back and go, oh, it's not what we thought it was. And some of this new information is helping a lot. And real quick, kind of like the difference is there was a research project, and they put people in an MRI, and they were going to test people that had either what they call substance abuse disorder or substance abuse dependence. And like you say, there's a little bit of a nuance between the two. But what they found was some people, let's say, and they would fall into the substance abuse disorder category. They had negative affects. They're drinking, DUIs, ruined marriages, careers, things like this. But what they did is they put them in an MRI and had them think about their drink of choice or their drug of choice, right? And what would happen with those people is their prefrontal, I'll go this way, their prefrontal cortex lit up. They were thinking about having a drink or smoking a joint or whatever the addiction is, right? But your prefrontal cortex can think through time. It can judge like, oh, but I got a call tonight. I really shouldn't have a couple beers, or I have a soccer game. So you could make a choice at that level. But other people, a much smaller group, and these are people that could drink alcoholically, in the military or college or all this stuff. And then one day they just kind of go back to normal. They drink or not drink, And for many decades, that was like, well, once you cross, what's the old saying? Once you're a pickle, you'll never be a cucumber again, right? Once you're pickled, you can't. But now it's like some people could do that. One of my best friends was like that, right? But some of us fall into this other category where it's a substance dependence. What happens, you put them in an MRI and you have them think about their drink or drug of choice, their prefrontal cortex goes dark. Their midbrain lights up. They go into survival mode. So having that drink, having that drug is like survival. And it kind of begins to rewire the brain. You know, you have three things that midbrain, the deep brain's trying to do, right? Keep you safe, you know, from predators and things, help you find food and safety and security, and also then procreate, you know, whatever. That's a whole different talk. But anyway, but what happens with certain people, once this alcohol or drug is entered into the system, it reorganizes it where the alcohol or the drugs takes the top spot. And it's more important than food, safety, security. And that's why, and it starts the craving mechanism, right? And it has to do with no one's really, alcohol and drugs are not the problem. They are the solution to the problem that people have, right? In my case, it was stress, it was guilt, it was traumatic experiences from my childhood, things like that. And the drinking shut everything off. So that was my solution. And so you have to help people, you know, decide, first of all, are they in the dependence phase or are they in the abuse phase, right? Unfortunately, most people will always say, no, I can do it again. How many people have had a friend or relative go through treatment, get a little sobriety, and then they're like, they start drinking again, you know, or drugging. And you're like, why? Well, they thought they could handle it. Well, that lets them know, nope, you're probably over here. And because the drug you're really addicted to, or the behavior, is dopamine related, right? And especially when it comes to drugs or alcohol, it gives you more dopamine than your brain can really handle. So your brain sets this threshold so high that things that would bring normal people pleasure, going out to a nice dinner, doing something like this, should bring you pleasure, after it doesn't even register. It's why you hear people and trying to quit going, everything's boring. And the biggest fear people have, especially with drinking or now smoking or vaping, is I'll never have fun again, right? And it takes a little while. It takes, like, I'm sure Dr. Rosen can talk about it too. It takes about 6 to 18 months for your brain to reset where the dopamine threshold comes down and you can enjoy life again, right? Without adding the instant boost of dopamine that alcohol or drugs gives you.
So this rush of dopamine, which is often comes from learning new things or solving problems or other things, is it a particular problem for high achievers, professionals?
Actually, I would say yes, because if they're very successful, you see people, their success kills them, right? I knew someone like that. They built a business, machine shop up in Northwest Indiana, where I was from, and the way they set the business up, they own the business, so they're making this money. So they ended up, basically, the other two partners kind of pushed him to the side because he was starting to destroy the business, but he's still making the money, and he ended up drinking himself to death. And his big thing was, every time his family or somebody tried to get him to go to treatment or go see someone, I can't be an alcoholic. I've got a 7-figure business rocking over here. And it's like, yeah, well, if they let you back in the shop, it would be a 0-figure business.
Which keeps them from being able to talk about it to anybody, right?
Yeah, and then too, the alcohol, and I'll pick on alcohol, right? Alcohol is the only drug in the United States and most of the world you have to justify not using. Right? If you're out somewhere and somebody says, you want to drink? No, I'm fine. Are you sure? Yeah, I'm good. Well, we have beer, wine. They'll go through the whole litany of shit, and then they'll say, you have to justify it, right? And this happened to me, like you mentioned that one conference. I was there and people, they're like, don't you want anything to drink? No. And they're like, you're in Vegas. No one will know. I go, trust me. The Clark County Sheriff would probably know before midnight. And, I don't want to end up in handcuffs. And those aren't the fun kind of handcuffs. I don't want to end up in handcuffs in the back of the squad car, right? But so then when you move into the professional realm and you see it everywhere, it's almost like you go out to dinner, how are you going to handle this? How are you going to handle that? Even though I will say that one of the great things we have going for us here, and at the one-day training, I'll show you things we can do to help people, is we have the ability to do that because also just in the culture, unless the economy crashes and people drink and drug more when the economy crashes. Because like little known fact, alcohol sales went up over 30% during COVID, and they have not fallen, right? But so we can help people make those changes, right? And handle how do you handle when you go out to dinner? How do you handle this? Like I always say, if I'm somewhere and somebody goes, you want to drink? No, I'm fine. You sure you got this? We have this. I go, no, I don't want to drink, but I'll take the money. And then they quit asking. Yeah.
So, Will, you've touched on a bunch of stuff here. You've touched on habits and you've touched on the difference between addictions and problems and how to check it out. And you've touched on some neuroscience and stuff like that. What is actually going to happen in the workshop? Are you going to be able to cover all of that stuff in a day?
Oh yeah, it's really pretty simple. It starts with, again, addiction isn't what you think it is, and I use this thing called the levels, if you will, or the boxes. How you fit. When you're born, most people are abstinent. They don't drink. And even through most of your childhood, you don't drink. But as we all know, as hypnotists and NLPers, all of those formative years, you're developing beliefs. So if the only time you see your mom and dad get along is they're having a few beers, right? Or this is, your brother and sister talk about how much fun it is, your older siblings. So you develop the belief about these things, right? So this gets in the back of your head long before you pick up a drink, right? And then the media will, the things we watch, it's funny in our culture, we glorify it and we condemn it, right? Like a show that was on for a long time, like, Yellowstone, all the real cowboys drank, right? If you ever met somebody that really worked on a ranch, you tell you don't drink as much as you think, because 4:30, 5 a.m. gets, when the cows start screaming, it's pretty early, right? And you got to get out and do this stuff and that. But in the thing, they're drinking, they're that. And then, of course, but wait, there's more. Kevin Costner and the rich people are drinking their fancy bourbons and scotch out of crystal glasses. So again, it's equated with that. So that's all this stuff. So I'm going to talk about like what leads us from experimentation to social using, where most people can do that, to the people that develop a substance abuse problem. And then what's the difference between those and the people with a true addiction or dependence, and what we can do to help speed that up. And it's going to be a lot of fun. So I tell people, even if you don't have an addiction problem yourself, but what if you have some bad habits you'd like to give up? Chocolate, sugar,
So,
the addictions we dare not speak of.
I'm sorry, Michael. You're muted, Michael.
Whatever you said was brilliant, Michael. It was brilliant.
Well, it was, in fact, it was just so brilliant. I hope I can possibly begin to recreate it. You said a minute ago regarding alcohol, we glorify it and we condemn it. And I think one of the things that's interesting to me is it also seems to be true with recovery. That in a sense, somebody goes through rehab, and on the one hand, we may praise them and acknowledge them and, oh, thank God you've done this. And on the other hand, people look at somebody who is identified as a rehabbed alcoholic as maybe not to be glorified, but looked down at as well. And there's that shame issue there.
Oh yeah, and in the coaching community, and a lot of people, I think they're just doing it to cash in on internet marketing. But they're anti-12-step, they're anti this, and it's like, I'm for whatever works. But yeah, if people get in recovery, they don't understand it, right? Because was a couple conferences ago, I don't remember which conference, but I was teaching on addiction, and somebody says, well, do you still call yourself an alcoholic? I said, yes, even though it'll be 41 years, St. Patrick's Day. A
Wow.
great day for an Irishman to quit drinking, right? But and the person, and they wanted to like, well, why do you do that? You're labeling yourself and you do that. I go, well, now we're getting into a linguistic argument, but what does it matter to you what I call myself? But anyway, there's a lot of misunderstanding. People, like you say, they'll send their kid off to rehab or their husband, wife, whoever it is, employee, and then they come back. Well, but don't go to meetings, right? And not everybody needs meetings. And I'll talk a little bit about how the 12-step program actually works and why it's so misunderstood, and how to help people speed it up.
So who is this workshop for? Is it for coaches and therapists? Is it for addicts? Is it for hypnotists who want to break habits? Who is this one-day free workshop for?
Well, it's mostly geared for people that are gonna help people with the problem, right? And end users could use it, but it's like here's this, because the best thing that happens when you learn all this, if someone comes to you and they're not sure, and many of us have had the experience where they come for one thing and a couple sessions in, you find out they're drinking too much. I used to get a lot when I first moved to Florida. It's like, oh, I want to lose weight. And after we're doing it, it's like, what the real problem is? I'm drinking 3 bottles of wine every 2 days, because they're retired. They got, they're in a little golf community with the golf carts, can't get a DUI and no reason to get up tomorrow and not to make fun of the villages, but the villages, But so what we want to do is help people. Like the easiest thing, that if you took nothing else from the whole training, when it's over, if you understood it, if you explain to people, it's not your fault. It's how your brain works. It's just the genetic twist. As much as I'd like to be 6'2", 215 pounds, I'm 5'8" and $160, It's just that my brother's like 6'1", 220, but whatever it is, it's genetic makeup. And once people understand that, then it gives you some power. And I love the saying, it's not your fault, but it is your responsibility.
I was going to ask about that because if you just give the message, it's not your fault, can that not be used by an addict to say, so see, I can't do anything about it.
Yeah.
I'm in a hopeless vibration. I'm locked in. There's nothing I can do. I can't get better.
Yeah, it's your responsibility, right? Once you get the information, it's like, okay, you could change or not change,
Well, once you see the change, when they see the change, it's hard not to see it. It's hard to ever unsee it.
Oh yeah.
Right.
So here's some great information, and I appreciate what you're sharing with us, Will. I guess what I wonder is, can you give us a little peek in terms of what is it that makes the approach, the using of that information that you do different than other programs and other approaches?
Well, it would be, that you're going to help the person begin to understand that, through what we teach, like the other way to boost your dopamine and rebalance your brain chemicals is through, you could call it meditation, but we also know it as hypnosis, right? Because that begins to reset it, right? And it helps them. What we can do is show people how to go back and look at their past in a different way, with timeline and some of the stuff. We'll do a couple of those techniques. So you reframe that to let go of the guilt and the shame, remembering what happened, and then bring that forward, and then go into the future and create the you want to be, right? And we can give them these little trigger words, like one I always teach people is, whenever it comes up about, again, I use drinking. If somebody says, well, you used to drink a lot, it's not who I am anymore. It's a little linguistics, just not who I am anymore. You're not denying it, it's, but it's not who I am anymore. So we speed up this process and give a little bit of a structure to it, and always in there is my one of my favorite NLP techniques, and I say that over and over again, whatever technique, but this one really is, which is the visual squash, where you begin to bring up the conscious things, like this is why I want to quit drinking, but I enjoy it so much, or it's the only way I know how to, that I can get relief,
Mhm.
from the demons in my brain. And so once you do that, you get rid of the conscious subconscious conflict, then you can speed things up.
Okay, now you invited us to ask this question, and we've only got a few minutes left, so I've got to ask. Can you share a real life, real world success story of someone who's applied your methods and changed their relationship with alcohol?
Oh yeah, there's a guy came to a stop smoking seminar, right? And so I'm doing this back in the dog and pony show days, right? Like that's how I know Bob Otto, by the way, doing the dog and pony stop smoking shows. And this guy says later, he goes, "Hey, can you help someone with drinking?" He goes, "Because I smoke, I drink, I smoke, da, da, da," And he'd been to the seminar before, and he goes, "Every time I have a beer, I'd start smoking again." I said, "Well, why don't you just quit drinking?" And he goes, "I don't know how." And I go, "Such a deal I have for you, such a deal." And so, he called me up, and before I left town, we did a couple sessions. And I guess to speed it up, he got so into it. He got sober. He was going to some 12-step meetings. He was enjoying it. He became a hypnotist. He went on the road doing stop smoking seminars. It was amazing. And all I did was give him a few simple tools, right? And then he got into it, right? Because it released all those creativities, right? So is my buddy Rich. I still call him that, right? He's pretty much retired now because I'm a little long in the tooth myself.
Well, all right. So for anybody listening that suspects that they or someone they care about has a drinking problem, what's the first step that they should take today?
Well, it's interesting. If you were going to design a system to make addiction worse, it's the system we use, right? With the intervention and all this, like Michael, you change or we're never going to talk to you again. Which is what they really need is more connection. Yeah, yeah. but you want more connection, right? And we criminalize it. And then we get people like, felony arrests for like felony DUI. And now, so it's the opposite of what seems to really go on. So if someone it's like, first of all, be there for them and help guide them. That's the best we can do. But don't cut all connection. Because contrary to like whatever that show Intervention said, that usually doesn't really help people.
Yeah.
But if you do want to know how to help people, this might be a workshop you want to take. It's a
And
one-day.
it's free. And I bring in Ginzu knives. Ginzu knives, I say.
It's going to be Thursday, the 15th, and Dr. Will Horton will be there for you all day and teach you how to help people. Is that not a cool thing? Thank you, Will, for this offer. We really appreciate you tonight. We'll see you in Orlando. I look forward to it. Always look forward to seeing you in the hallways at the conferences and getting that few little moments.
Yeah, I love the hotel too. I love it.
There you go. We're going to have a great time. Everybody come and join us. Those little powwows before and after and in between is all great. And now I'm going to turn this back over to Michael for the second half tonight and my sister wife, who I'm always delighted to hear from in the brilliance that she brings to our community. So Michael, take it away.
Sister wives, I love I love that. That's great. Well, I don't know where to start here with an introduction because first of all, I have two people to introduce. I have Patti Scott, who, well, Karen called a sister wife. Patti and I have done a lot of work together through the years and known each other forever. You know I love you, Patti, so I'm just so glad that you're here. And Eric, just a star in his own right here in Orlando, working in therapy, and we're so glad to have the two of you together. You've been running this medical hypnosis program for gosh, you'll have to tell us once we get started here just how long this has been going on because it's been quite some while now, and we're thrilled to have you. So welcome.
Thank you, Michael.
So Where do we
Unmute,
start?
Eric. There we go.
Thank you.
There he is. So where do we start? Who do you think would best benefit from taking your training? And by the way, do include here, let us know, how long have you been doing this now, the medical program?
It's funny, after he asked that, I wasn't sure because I started putting this together a long time ago. And then when I met Eric, Dr. Rosen, we started working together. So it's been in the works for many, many years, and it has evolved. It's I don't know. What do you think, Eric? We've been working together with this stuff for
15. Yeah. So we've been doing this for a while.
Yeah. Long time.
Yeah.
So well, in fact, this leads to something. So let me go ahead and ask this other part of the question, which isn't quite about the content of your program so much, except that you have been doing this for quite a while. And I know that there's more to it than just this one-day program that you're doing, that it is a specialty training, is it not? And there's some kind of certification and things available along with that. Can you just talk about that a little bit so people know what this was?
Yeah, this was developed through many, many years, like I said, as a 2-weekend specialty training. It was inspired by my first medical hypnotherapy teachers in the very beginning, way back 30 something years ago, back in Arizona, which is where I met Will Horton. By the way, I want to lodge a complaint. They always put us on the same day as Will Horton's. I can never go to his seminars. And I just really want to complain about it. Anyway. So yeah, it was inspired by Dr. Michael Preston, who wrote Hypnosis, Medicine, and the Mind. And after that, a whole lot of other people that I studied with that were amazing. And like I said, it evolved. And then by the time I met Dr. Rosen, who's a licensed psychologist here in Florida, it really took off like a rocket ship with us working together and propelling it into something that I ended up sending it into IMDH and got it approved as a specialty certification training through them. So that's a 4-weekend training, but you have to have 200 hours of hypnosis training to do that. This training, they get a certificate of completion, and it is meant to be a standalone day of training, just to clarify.
Okay, are there any prerequisites?
So are there any?
Oh, sorry.
Me the same idea. Are there any prerequisites? Did somebody have to have the 200 hours of hypnosis or whatever to take this?
For certification, to take the 1-day training, there's no prerequisite. They have to know hypnosis, hopefully, because we're not going to cover the basics, right? Eric, jump in. You know me, I'll keep talking.
Yeah, it's essentially this came together in our working together and teaching over the years. There's a strong need for people coming in, even when they come in as clients and they're dealing with, I love what Will Horton said, that people come in with one issue, but there's oftentimes life happening in the background. And life also includes what's happening with our bodies and also different things that we're dealing with. And oftentimes people have a host of medical issues they may not be coming in for, some will, but at the same token, we have the opportunity to access providing help across a whole plethora of different areas. And we're going to be talking about what those are and helping to empower people that doing medical hypnosis, you don't have to be a physician. You can be licensed, but you can be certified. And what you're doing is offering your skills to help people cope better with what they're dealing with.
And you know what they teach works. But, you know, I hope I don't jump the gun here. Will kind of saved his success story for later. But man, Patti shared before we started today, one of her students who's on here. Do you suppose he would talk a little bit, Patti, about the success he's had from your training in medical hypnosis?
Well, actually, he's not in a medical hypnotherapy training. He's actually in my hypnosis training. And we just talk a little bit about see, that's the thing, the people coming to this that are doing hypnosis with people, or hypnotherapy, if they call it that, they already know, they already have the skills, let's put it that way, to do what we're going to be introducing to them. So this
you're
training is really
on that. I mean, you're advancing that.
Yeah, this training is to get them to realize and how to strategically apply those tools that they already have, and then expand those and focus those and how to strategically apply them for medical issues that then would allow them to get referrals from doctors and that. But this student, Cliff, that's on today, he's only a little halfway through the hypnosis training, and he took off on some things I had introduced in that training and ended up doing what he did. And if you want to take a couple minutes for him to tell, it's fine with me.
Cliff, do you mind doing it in a second, 30 seconds or so?
No
Yes.
problem. Yeah, when as I was saying earlier, I had a dentist appointment. I had a tooth that had broke and they had to remove it. They're going to do a dental implant, and I wanted to go in and not be put to sleep and not have any anesthesia or anything. And so I asked the doctor about it. He wasn't totally comfortable with it because I kind of pulled it on him in the last minute. So he said, "Let me just do a little bit of local there." He said, he said, "I'm doing this more for me than I am for you." And he went in and I mean the tooth just came right out. I did a little bit of gratitude to the tooth and thanked it for its service for all these years and let it go. And yeah, it was there was basically no bleeding and I had absolutely no pain afterwards. So so that's kind of it in short.
But my point about that, and thank you, Patty, and thank you, Cliff, very much for sharing that with you and with us. And Patty, thank you for letting us share that because that's what one of her students, and Eric adds even more to the presence. That's what one of her students, baby hypnotists, can do with this information. Now, you've got skills already. And so give me an idea of in the workshop, the kinds of things that people are going to be adding to their already accepted skills so that they can do miracles like Cliff did. He did that for himself, but they'll be able to help other people do things.
Well, like I said, strategies, and part of it is the pre-talk, how to do a pre-talk with someone that has a medical issue or a diagnosis, let's say, something that would be in the medical or clinical realm. And we developed something that we said, doctors have treatment plans, and I hadn't heard of hypnosis having anything like that because usually we don't plan. We're very spontaneous, but to have an approach and a strategy for the session, for each session, we came up with the term hypnotic outcome protocol. And that's all developed in the pre-talk. So that's something that we developed together through the last few years. And it's HOP for short, because, we love acronyms. And Eric, you want to talk a little bit about that?
Yes, oftentimes people coming in, if they are having any kind of issues medically, then as a licensed clinician, I have to come up with what they call a treatment plan. But we know that for people that are certified clinical hypnotherapists, having different ideas of how am I going to help somebody with the issue they're coming in with. So Patti and I came up with the idea of a hypnotic outcome protocol, which means what are some different ways, some strategies for how we can help people. Some of these different areas, I'll just give you a couple examples, can include helping people to feel better about what their medical issue is. Oftentimes when people have medical problems, they carry a lot of what Michael was talking about, a lot of shame. It can feel like your body has betrayed you, that what was working before has stopped working. And so we have to help people understand that their body is a vehicle and we can help the vehicle to run better because it really starts with what you're thinking. It's the different thoughts we have about how we function. And oftentimes those cognitive distortions, those different beliefs we have are actually working against us taking care of ourselves better. We run into conflict so that people that are dealing with diabetes, helping them to feel more empowered so they can make better choices of self-care, helping people to deal with the stress of living with pain and seeing that, yes, there's discomfort, but what happens if you can find other meaning in your life? The issues of being able to strengthen your self-care, also being able to deal with fears. People oftentimes can have fear of injections and needles and going through procedures. We've worked with people that have to do an MRI or a CAT scan. They have to get in these little chambers, and people can be so nervous and anxious about it. And we have all the tools to help them.
Michael, you're on mute.
I'm sorry, I keep doing
I
that.
see your mouth moving, but I don't hear anything.
Yeah, well, it's like that Jerry Mahoney thing. The ventriloquist stepped out of the room a minute ago, and it was just the dummy sitting here moving his mouth. But but because I raised the issue earlier or mentioned the thing about certification and that other thing, I prompted, I guess, a question from the audience that I want to clarify. She's asking, please clarify, do attendees of the one-day medical hypnotherapy specialty training at the HypnoExpo in May get certified if they already have the 200 hours of hypnosis training prior?
No, they don't get certified in medical hypnotherapy in that one-day training. They get a certificate of completion in medical hypnotherapy, and they get the CEUs for that day. If they want to become certified, it requires an additional 4-weekend training. And actually what I do, I guess it's okay to say it here, what I started doing last year is if anyone takes the one-day training and wants to go on to get certified, it's all online. It starts actually on, what's the date? June 28th is when the medical starts. It's not consecutive weekends, but it's 4 weekends. What I did last year and what I'm going to do again this year is I deduct the entire cost of their one-day training at the HypnoExpo from the cost of certification, and I pay for the certification also if they're a member of IMDHA already. I actually cover the cost of the extra certificate, which normally would cost them another $50. So that's just if you really want to get more into the minutia of it. The one-day training, I want to really emphasize, is meant to be a standalone to get people excited. The first year I became certified 33 years ago, I studied medical hypnotherapy. I think it was like a 4-day weekend I did it in, and it hooked me. It got me so excited about doing it. And I have never stopped training in those areas since then. So there, everything's a beginning. I don't think there's ever an end to the training that we want to get from as many different styles and people and approaches as we can. This training this one day is designed to get people to, first of all, realize how to apply strategically the skills they already have, because we can't teach a hypnosis, in this training. So hopefully they already have some basic hypnosis knowledge. That's helpful, obviously. And when they leave, they will be inspired, they will be motivated, and they will actually have confidence to know right now, when you go back home after the training, you can start, going out there and marketing for doctors' referrals. You can work on these things. Because I think a lot of people are just afraid to approach it. But I know Will Horton, he was talking about the chemicals, in the body and all those kinds of things, and the hormones that are released. It's all related. Anything that comes in the door is going to be an emotional based issue. And like Dr. Rosen was talking about, if somebody comes in with depression, there's certain chemicals and changes in the cellular structure even that happen from all the chemicals that are released. And through time, from what I'm told from doctors, even with depression, like I think Will even mentioned this, people can have the most happy event happen in their life and they don't feel it. They don't recognize it. Right. And with these kinds of, we can help to teach people how to think in a different way to start to turn those things around. And now that we know with neuroplasticity and psychoneuroimmunology and all these new sciences that are popping up, I think partly because of what we've been doing. Yeah. But maybe that's just me. That's just my opinion. But, they're starting to realize now by checking the brain scans, the scanning equipment we have, that we can help them to change with their thoughts, with their mind. We can help them to change the body and the cellular structure. And according to Bruce Lipton, even the DNA. So to me, this gets me, if you can't tell, gets me excited. I was excited 33 years ago, and I just get more excited every year. But that's what I want the people to walk into this one day with, that kind of excitement, because there's now with the internet, and there's really a lot of junk on there, but I have a lot of materials and research that is focused on helping us to help our clients. And like I said, I sift through all the junk that's out there, and every week, every month, every year, I get more science, more of the good materials that you can look for, the good trainings that are on the internet from Dr. Michael Yapko and David Spiegel and some of these other people that are really legitimately, seriously, doing something in this field. So
You know,
anyway,
and Eric, I practice in Illinois, and we have kind of a weird state in that our regulation is, since hypnotists are not licensed, if you're not an RN or a licensed professional, LCSW, in Illinois, you better call yourself hypnotist and not hypnotherapist, because our regulation is we can't step on the toes of the licensed professions. So does your training include some of that finesse, how you work with those boundaries, how do you work with the semantics of it all, and how you work with medical professionals so that they'll respect a lay hypnotist?
Well, you're bringing up a good point. I think one of the things that we focus on is scope of practice, which means not competing with physicians. We're actually an integrative auxiliary service that helps physicians. So we're not trying to replace them. And we can help with things that help people to take care of themselves better. And when physicians know that we're helping people to feel more motivated to help themselves, to work with better personal habits, have increased their motivation to follow protocols, to do what they can, then you will definitely need more cards. Because here's the other thing. The fears that people have around medical procedures is tremendous. Being able to help people to feel empowered so they can embrace whatever the treatments are they're going to be dealing with. The other part too is, we don't compete with what physicians do, but let's say people are going through different kinds of cancer treatments. We can use hypnosis to help them to deal with some of the side effects that can happen from different medications. And a lot of that also is relaxing. It's amazing when we use basic hypnosis, and I've had this happen countless times. Somebody is sitting in the chair or on the couch, and when you finish, they'll actually say, "This is the most relaxed I've felt. I can't remember feeling this way." And when the body relaxes, stress hormones change, our thinking changes. We can then do and experience life better. What we're really doing is helping people find meaning in their life again.
Yeah.
That's what we really offer people. Because it's amazing when people are dealing with serious medical issues, they erode not only hope, but also daily functioning. I think they affect our spirit. It really takes away joy and meaning. That's what hypnosis helps people recapture.
Yes.
And so we actually have a whole list of things, and we cover these different areas with the techniques. So when people leave the training, they will feel empowered to be able to go out and target some of these different areas, infringing on any of their state laws or infringing on what medical physicians are doing. They'll see you as an adjunct.
Mm-hmm. Eric, just
and
couple of years ago here in Florida, you were talking to the Hypnosis Education Association, and it must have been maybe 2 years, maybe a little bit longer than that. But you really gave me a moment that I think really was an important aha for me and my understanding, and and I really want to sort of draw it out here. That is, in the last year or so, we've had a lot of health issues here in my household, and probably spent more time around doctors than I ever have in my life. Well, one of the things is medical professionals, generally speaking, have something like 12 minutes or 8 minutes, it depends on who you talk to, to spend time doing what it is that they do, which is not the kind of thing that we don't have that limit to the way that we work with clients. And so it gives us the opportunity to provide something that doctors can't possibly provide alongside of the expertise, of course, that they bring to their work.
And I think you're bringing up a good point. The volume that physicians have is tremendous. And yet when we're taking the time that we take, people feel heard. I believe a lot of what we do happens also in the pre-talk. I mean, all the hypnotic strategies that we use and the techniques, but the pre-talks help people feel cared for, and it helps them relax. And we also I love the expression that what we really are guardians of hope. That's what we're really selling for people. And when people are dealing with medical issues, they lose hope. And sometimes it's so real because we're dealing with life issues. But we can work with people even with end of life issues. We can help people again to feel that their life matters with what they have.
If somebody has a medical hypnosis certificate, do they also walk away from your training this one day and even your more extensive training, um, believing they have techniques that are helpful or believing they can heal people?
When you say heal people, I have a little stickler about that term. I think we all heal ourselves. I think we're helping the client to learn how to tap into their inner healer, you might call it, right? Or depending what language you. So I don't like to say I heal people. You know, we don't treat, we don't prescribe, we don't diagnose. Those of us that aren't licensed, that's, you know, the three things. And I don't heal people. I help them learn how they can heal themselves or help to heal themselves inside. Because again, you're only going to help someone with what's possible. And the only one that knows what's possible, in my opinion, isn't the doctor or the client or me. It's their unconscious mind, their inner that runs their body. You know, each individual has that intelligence inside of them. So to me, it's that's a big part of this. And talking about the pre-talk and to me, that is where a lot of the work is done. And the listening part of the pre-talk for medical issues is so important. And we really put a lot of time and emphasis on that because it is about us hearing them from what I call the subtext of what's going on, not the surface or the symptom or the presenting issues, sometimes we call it. It's what's behind it is what we as hypnotherapists are so wonderful at getting to, which most other practitioners or even, you know, people from the world of psychology generally aren't as adept as we are at talking to and listening to the unconscious part of that client. Because that, again, I call it the expert in there. That's where I want to get the information from, and that's who I want to talk to in the interaction to start activate that inner healer and to get them, like Eric said, we empower them and teach them how to talk to themselves, how to think in ways and put their focus, because hypnosis is focused attention, right? It's what you focus on, you manifest, and teaching them how they can focus on things that empower themselves and that give them as much control, if that, you know, as possible in any situation, and to get them to feel like they can deal with whatever parts of their treatment that the doctors are doing or different tests they're doing or whatever, that they have the ability to calm themselves, to stay patient, to stay calm. I just had cataract surgery 2 weeks ago. The cataract surgery was like 5 minutes, no anesthesia, no pain meds. That part was fun. The 4.5 hours leading up to it, someday I'm going to do a seminar on, because it was really challenging. As I was relaxed. I was ready to go within an hour, and then it was another 3.5 hours. But we can teach clients how to deal with unexpected things. See, that's the thing. The world doesn't always cooperate, so we can help people to learn in the moment how to shift. I call us state shifters. We teach people how to shift their state, and if we can do it in the pre-talk and get them into an empowered state, now we can start teaching them how to recall that, how to get that going. And then if something unexpected happened when they go to the MRI and they didn't expect to freak out, but all of a sudden they're freaking out, now they have some tools that can apply to anything. So it's not like you have a formula or you have a cookie cutter for each situation. Everything, whether it's addictions or whether it's any kind of a medical or mental health issue, even things I've never heard of, it's going to be the same strategies are going to apply. So that's why we can do this in a 1 day or a 4-weekend training, because once you get the principles, you've got the package. You just expand on it then, right?
And it's so important work. And doctors are used to referring their patients to other people. That's just the most natural thing they do. Oh, you should see a pulmonologist for that. Oh, you should see a rheumatologist for that. Oh, let me send you to this dermatologist for that. Why not have them say, oh, that's something best addressed by hypnosis? Even the
Right.
Mayo Clinic says there are some things best addressed by hypnosis, so it's not foreign for doctors, right?
And
This is
that's the other part that we get people to realize. We can be a very specialized, unique part of the medical team. And we're the only ones that can do what we do out of all those other people that they refer to. We have a very specific expertise, and that is we know how to talk to their unconscious mind.
And some of the things we can work with, IBS, migraine, some of the things that Eric mentioned, doctors don't have time to work with that anyway. And big pharma hasn't done much for it either. There aren't any good drugs that deal with it either. So when doctors do have a non-drug answer, they'll use that too. And so the things that you're teaching, the work you're doing is so important, Patty and Eric, because it's really valuable information. And since we've got the tools, we might as well add that to the toolkit.
That's right. That's right. Right, Cliff? That's right.
That's right.
He hears that a lot in our class.
Yes, I do. That's right.
Well, Cliff is here to attest to it. So that training is going to be one day on Thursday, the 15th, and it is medical hypnotherapy with an optional certification opportunity, but you will get a certification for the one-day training.
They get a certificate of completion in medical hypnotherapy, a specialty training in medical hypnotherapy.
And more important than the certificate, although certificates look really nice on the wall, more important than the certificate, they'll go home and be ready to use this stuff when they go back into the office. I mean, there will be instant techniques that can be instantly used with clients who appear.
Absolutely. Eric, do you want to add anything else at the end here?
Michael, you are muted. It looks like Michael wants to say something, but he's muted. And I didn't mean to interrupt you.
I do keep muting myself. I'm sorry. I've got a cold and I don't like to cough with my microphone open. I was just saying, well, we're actually coming to the end of our time now, and I want to thank Patty and Eric, of course, for being here and sharing about their program. It's truly exciting, and it has stood the test of time. You know, I know there's some people that come out of a program like this, and they tend to specialize on a particular area that they have interest in, and other people really apply it across the board, and you know, however it is that you want to use it, Patty and Eric really have something valuable to share with you. Just really quickly, and forgive me for stepping off of that for a second, because we are ending. I would just like to mention that a week from tonight, we will be back here again, of course, with the presenter series, and you'll be hearing from Jessica Hansen. Some of you heard from her last week as well, talking about the client-centered parts therapy. But this time she's going to be talking about the train the parts therapy trainer. She does a trainer training as well. So she'll be one of the guests next week, and I will be one of the guests next week. So Karen, I hope you will be hospitable.
Well, of course I will. I can hardly wait.
And I'm going to be talking about the stress management consultant certification training, which is a 2-day program on the Monday and Tuesday after the weekend at the conference. So it's getting exciting. It's building up, and it's going to be such a wonderful, wonderful time. So, Karen, one more thing. We're going to say goodbye to Patty and Eric in a second, but before we do, we are also the virtual chapter. Karen Hand and I are the hosts of the virtual chapter, and that's kind of why it is that we're doing this. So we have a meeting of the virtual chapter tomorrow night. We hope that you will join us. And Karen, can you tell them about our guest?
Yeah, we have Jeff Benink on. He's from the Netherlands, and he's a hypnotist, and he's an improv guy, and he's a clown. He does all sorts of things, but he uses hypnosis particularly as a program for their schools, where they're teaching people how to deal with emotions. It may remind you of Inside Out a little bit, but it's so interesting to hear how they're working with emotions in the schools, and the schools have adopted this. They're teaching teachers how to help their children think, use critical thinking skills. It's amazing. So Jeff is going to be talking about that with us tomorrow night. And remember that we've all switched. Well, those of us in America who do switch have switched to standard time. Those in America who don't switch, you're still on whatever time you guys celebrate. And in other countries, some of you haven't switched yet. You don't switch till the end of the month. So just know that we are at Eastern US time tomorrow night, and join us. Try to figure out when that happens.
Well, and as a matter of fact, it'll be the same time tomorrow night that it was tonight at the same time. And that's when we will begin. So 8:30 Eastern time tomorrow and till 10 o'clock. And we will look forward to seeing you then. So in the meantime, Patti, Eric, thank you so much. And
And
Will,
Will, thank you all for being here.
I don't see Will still on my screen, but if he's still out there, I see his.
Still out there.
Yeah, so thank you so much, Will, as well, for being there. And hope to see you all at the conference. It's going to be a great time.
See you in a few weeks.
Good night.
Thank you, Karen. Thank you, Michael.
Thank you.
Thank you, Patty, Eric,
Good night,
today,
Patty.
Michael,
Good night.
Karen.
Hey, Susie, good to see you again. I just saw
Nice
you.
to see you last night, I know.
I know.
Good night, everyone.